So I'm Arthur Roach. I'm the Director of Research here at Parkinsons UK. I'm actually a Canadian neuroscientist, I've been doing some kind of research into neurological conditions for most of the last 25 years.
Thank you, Arthur. I really appreciate you talking to me. I know this is a weird question because there's no such thing as an average day, but what does an average day at Parkinsons UK look like for you?
I spend a lot of time in emails and meetings. The meetings are often, they can be at Parkinsons UK, but they can be actually anywhere in the world. Meeting with scientists and companies who are working in the Parkinson's area. And a lot of my job is trying to coordinate, support, and generate the decisions to move ahead on important funding things. I don't make these decisions myself unilaterally. It involves cooperation, collaboration, consensus, and sort of leading and building that consensus. I think is probably the most important thing I do.
So what did you do before you started here? It seems like something that you kind of really dedicate your life to almost, working in this area.
Yeah, so I've been, as I said, working in neurological research and different conditions for the last 25 years, multiple sclerosis, Alzheimer's, and Parkinson's principally. Immediately before working here, I was working on setting up a very small startup company to bring a new treatment for a couple of rare neurological conditions, not Parkinson's. And that really taught me a lot about all the pieces that have to come together for a successful project. There's the science, critically important, but there's also finance, and there's also regulatory, and there's clinical trials, and there are many parts that have to all come together. And in a small company, you see it all, and that's a little bit the inspiration for some of the virtual biotech approach. Before that, I was working in large pharma companies with thousands of people spending £1 billion a year on research and development around the world.
Can you tell us a little bit about virtual biotech, please?
Yeah, so that is, the idea there is that to get a new treatment for a condition like Parkinson's, you need a whole lot of pieces to work together. You need the early discoveries to be made in the university sector, and Parkinson's UK has been funding that kind of work for many years, actually, doing a very good job of it and making some great discoveries with the investigators here in the UK. But there are later stages where those ideas have to be turned into molecules that are then tested and refined and ultimately go into clinical studies and ultimately get approved by market regulators, and there's really no way around those steps. And the steps of turning the ideas into drugs is an area that a lot of the previous players in the area, pharma companies, are withdrawing from. They're finding it too difficult, too high risk, and too expensive. To be sure, they're still doing it, but much less than is needed. And we felt that at Parkinson's UK, we can actually get involved in that stage and make a difference ourselves and pick up some of the great projects that are just waiting for funding that no one has quite picked up on yet, bringing the pharma companies back into the area by offering them attractive projects to fund. And so in the virtual biotech program, we're trying to act as much as possible like a biotech company, the same kind of thinking, same kind of urgency, the same kind of efficiency and speed, and the same kind of focus on getting something all the way to being adopted in the clinic.
I think that's what Parkinsons UK do really well, that kind of thinking laterally and thinking how they can solve problems in a different way that's maybe a little bit groundbreaking at times. I'm quite proud to work for this organisation for the way that it does that. Yeah,
I think I was really impressed when I first contacted Parkinsons UK. They contacted me, and I met Steve Ford especially, and I have the impression he's always looking for a new and better way to do things, and it's sort of a conscious thing he does, and I have to be careful what I say around him. If it's a crazy idea, if he likes it, then he'll be wondering why we haven't started it 2 weeks later. So that is something that the charity sector maybe has more freedom to do, but I think in this charity it's more of a strength and a culture here.
Definitely. So why Parkinsons UK? Was there a kind of a personal connection with Parkinson's, or was there something else that drew you to the charity?
Actually, no, there's no personal connection. Fundamentally I'm a scientist. I like solving problems. I like thinking about how things work. I like fixing things. I like doing it in the biochemical, biomedical area. applying it to Parkinson's, there are two things. One is I do believe that Parkinson's scientifically is at a very interesting stage right now. A lot of discoveries that have been funded partly by Parkinson's UK, but other places have led to discoveries that are telling us more about what's going wrong in the condition and pointing to new ways to treat it. So that's a particularly exciting time intellectually. And then, as I said, Parkinson's UK contacted me with this opportunity that I would not have probably considered if I hadn't been contacted by them, and I was very, convinced and persuaded that there was an organization here that really wanted to do something different and would put resources behind it, and allow us to do something exciting and new.
What are you proudest of that you've achieved in your time here?
Yeah, I think getting the organization to embrace the idea that we can, even though we're a charity and even not the biggest charity in the world, we can work in this area of drug discovery and early clinical trials, that we can do a good job of it and not embarrass ourselves and not waste anyone's money. We're starting to get recognized for that. Companies are coming to us. Pharma companies want to know when they can get involved in some of our projects. We have a long way to go, but I think it's going well. I think the people are buying into the vision and saying, yes, charity can do this, and cheering us on. So.
This is the question that probably everyone with Parkinson's always wants to ask. What are you most excited about at the moment? What do you kind of feel has potential?
So I really think there's a wave of treatments to stop the progression of the condition that are in clinical testing now, and GDNF is one of them. Mm-hmm. Even though it's been going slowly, and even though there are frustrations, I really believe GDNF is capable of doing something positive and needs more time and needs more testing. So that's one of them. It works on a very specific part of the pathophysiology, but I think it's effective and potent and maybe part of an effective treatment regime someday. Other things we're financing, including through the Keystone Project. There are projects like that which, in that case, activate some natural antioxidant defenses, natural protection from neurodegeneration, which maybe one or two of those in combination, maybe with GDNF, might say that in early Parkinson's there's still lots of function and lots of cells left, and we can preserve that by giving the right combination of neuroprotection agents. So it's not just the ones we're funding, there are others out there, and I think in, hate to say 10 years, so I'll say 8 years, but in our foreseeable future, we will see new treatments which are slowing the progression of the condition. I really do believe that, I'll now say 10 years from now, some of those will be ones Parkinson's UK supported.
The thing is, I fully believe you when you say it, because you have, I think, so much knowledge and so much conviction, so it's nice to hear you say that. I
was just at a meeting in Turin where they were all presented, and it's a very promising field.
Great. I think it's going to be a very exciting 10 years. It's always 10 years.
Well, let's speed it up.
So how does someone with Parkinson's disease get involved in research if they're interested in it?
So yes, good question. Yeah, so there are multiple ways to do it, many of them through Parkinson's UK. For instance, one level of involvement is our research support network. So this is, I believe it's now over 4,000 people with Parkinson's and their families have joined this. People who are supporters of Parkinson's UK and want to especially get involved in research. They want to learn about it. They want to possibly volunteer to be in trials. They want to be in different types of studies. They want to be part of the group that is the pool of people who we have come in to either talk to us or talk to pharma companies about what is needed in Parkinson's research, what works in a Parkinson's trial. So the information from the Parkinson's community coming into the researchers. So through the research support network, yes, there are these opportunities to not only learn but also participate in, guide, prioritize research. From that group, usually we select people to be on specific panels, like a research strategy board panel, for instance. In addition, of course, being in studies and trials, there's research that takes place in a clinical trial, traditional clinical trial, where there's a drug that's being tested against a placebo, for instance. That type of clinical trial is happening in the UK all the time, and there's a way on our Parkinson's UK website to find trials that are near where you live to see if you qualify for them if you're interested. But there are many other studies which don't involve experimental drugs, that involve taking tests of different type to follow the condition, or looking at aspects of whether it's cognition or some non-motor skill to see how it develops, or non-motor deficit, see how it develops. There are many opportunities besides a drug trial to be involved in research as a participant.